nephrolithiasis and recurrent UTI. So everything has been said about climate change, but what I would like to say that climate change affects everything. And nephrology is going to be the poster boy for climate change, because most of the problems with climate change are going to happen to the kidneys and not to the other organs. The kidneys control everything as far as the other organs are concerned. The second point is that climate change is already here. It is there among us, and whatever we do today, we are not going to ameliorate that for another 10 years at least. Even if every single carbon dioxide producing resource was stopped today, we are going to continue to have climate change for at least till 2045 or so. And you can see this diagram, you can see that average temperatures all over the globe since 1960s have risen by 1 degree, and 2023 they were risen by 1.5 degrees. So we are really having a problem, and we should recognize it and try to solve it. So the first point which I'm going to talk about is renal stones and uric acid. So just look at this stone belt in India. These are the two major stone belt areas, most of them covering the states of Gujarat, Maharashtra, Rajasthan, parts of Delhi and Uttar Pradesh. But these stone belts are going to increase in size as a result of climate change. This has already been seen in the southern United States, and the extent of the stone belt has been rising into the north as we speak. So how do stones and high temperature mix? It's fairly simple, as we understand. The most important thing is dehydration and salt and water loss. In heat is mainly sweat losses, dehydration. So you get increased urinary concentration. This leads to increased urinary acidification. Both are risk factors for uric acid stones. And as we know, when there is a concentration problem, there is an increased supersaturation of calcium crystals, and therefore you can get calcium stones also. So both uric acid stones as well as calcium stones, both can be a result of this. But this doesn't rest to that alone. There is much more to it. So one is the things that what happens when you decrease your water intake, endogenous water sources are being searched for. Endogenous water, the most important thing is oxidation of fat and glycogen. These are things, as you know, animals like camels, they store fat in their humps, and this fat is used, oxidized fat is used as a source of water when they don't have access to water. Similarly, for all animals that do not do that, human beings are not producing much of water from you. Always have source to drinking water, so it's not a problem. But if you know that oxidation produces 1.1 gram water for 1 gram of fat and 3 to 4 gram for glycogen. Glycogen is obviously superior, but the source of glycogen are limited. You have a maximum of half a kilogram glycogen, where you can store any amount of fat in the body, as we know from when you go around the planet. So many animals utilize this fat source for their fat. It's a normal physiological response, but now it becomes pathological. So what happens is that heat stress, dehydration, volume loss, high fat diet, all of them cause hyperosmolality. And hyperosmolality will stimulate fructose because of aldose reductase activation. And added to this are when you don't have access to what happens in many of these climates, that people have access to soda drinks, colas, which are very tasty and which are addictive also to some extent. So you drink that, and that also contains additional source of fructose. Some of them are fructose fortified, some of them have sucrose, which is glucose and fructose. So therefore you get fructose from all this, and fructose will stimulate fatty acid synthesis. So just a little aside from this, fructose is a survival pathway, because fructose is evolutionarily designed to protect animals from hunger and starvation. So in times of stress, the body goes into fructose metabolism. It goes away from mitochondria, goes into the cytoplasmic glycolysis. And what happens here is that this important fructose is actually acted upon by fructokinase into fructose 1-phosphate and immediately enters glycolysis. Though this is a very, very rapid acting enzyme. Within minutes, it can absorb all the ATP in the cell, and then the ATP is converted to AMP, IMP and uric acid. So metabolism of fructose not only leads to gluconeogenesis and storage of fat, it also leads to production of uric acid and leads to stone formations. Powerful producer of vasopressin, so reduces water excretion to a large extent. And of course, fructose also important for obesity, because eating fructose does not lead to satiety. It causes central leptin resistance and shifts the energy production to storage. So this is also very important. This is actually a fact which has been used by animals for hibernation and all that, but unfortunately in human beings it is a reason for obesity. It's not important at all for us. And fructose therefore produces kidney stones because of several reasons. One is the increase in, one is the osmotic activity of fructose itself, which causes a dehydration, cellular dehydration. And then it causes hyperuricemia, as already seen, and which combined with salt and water loss and increased urinary concentration. And finally, it actually stimulates the ATP citrate lyase enzyme in the kidney, which is responsible for citrate metabolism. So less citrate in the urine, and that also causes increase in calcium stones. So not only uric acid, but also calcium stones. And you notice that people in these areas, especially in CKD areas, belts, they complain of dysuria and passage of material like sand and graveluria. So this is very common, and these people have been shown to have a uric acid level of more than 100 milligram, 1000 milligram per liter in the urine. That is equal to acute uric acid nephropathy as occurs in tumor lysis syndrome and others. So just by the effect of dehydration, this occurs, and that's another reason for stones. And lastly, about urinary tract infections and heat waves, there are very strong reasons to suspect that UTIs would increase during heat waves. Again, the same mechanisms: dehydration, salt and water depletion, concentrated urine, acidic urine, and also because of increased incidence of stones which predispose to infections. Increased prevalence of diabetes, obesity and all those things which leads to stones. And severe UTIs are also most possible because antimicrobial resistance has been related to climate change and heat. UTIs are more likely to lead to sepsis also in view of stones and obstruction which are there in these patients already. And you have two studies here. This is a huge study done in the United States, more than 1 million people, and they evaluated the heat exposure and incidence of urinary tract infections. So, and kidney disease primarily, but they found that there's a very strong association in ED which is related to AKI, kidney stones and urinary tract infections. And secondly, you look at this study, which was also published in the United States, again a very large patient population, more than 10,000 people, and you can see that urinary tract infections, they increase in number during heat wave days, and the hazard ratio was more than 2.5. So we have enough evidence that high temperature and UTIs coexist, and this will be a problem for us in the future as temperatures are going up. So to conclude, I would like to say that rising temperatures lead to a plethora of kidney diseases, and volume loss, dehydration and resultant urinary problems will lead to stones, and dysuria and urinary tract infections are going to be very common in these populations. Every effort we take to mitigate the efforts of climate change should be there, but realize that for the next 10 years we are going to see this happening in real life. Thank you very much.